patient will now perform a glide. The stroboscopy light will now be turned on. The endoscope will now be removed carefully.
Out of me. Good. Just breathe through the mouth. Just try to say e. Good. Now go. Just breathe. So the vocal cords are okay.
And give a vocalization. Let me crawl down a little bit. It's a beautiful looking larynx.
Really?
So, yeah, clear your throat a couple times. Good. Okay. Yeah. So let's do the strobe now. Kick that towards me just a little bit, if you would, Alicia. Yeah. We just have to switch machines here. Good. Okay, coming out. Okay, do that soft. More E. There we go. Okay, take a breath. Make E and do it loud. Very nice. Make E. Okay, take a breath. Higher pitch. Okay. Again. E. There you go. There you go. Do that lower pitch. Now do that loud. Okay, now breathe. Do that higher pitch again. Do that loud. E. There you go.
One more, loud. E. Think E. Okay, breathe. Again. E. Now do the inhalation. And do a regular one. And now inhalation. Okay.
Your voice comes from tiny resonating muscles called vocal cords. They're about the size of a dime in a woman and about the size of a nickel in a man. Your vocal cords vibrate very quickly, 120 to 240 times per second in conversation. The human eye can't track that. Video stroboscopy works like slow motion photography. It allows us to look at the vocal cords while they're vibrating and find ways to help them move normally again. When your vocal cords move normally, you have a clear voice. Go ahead and just go. Be loud now. Show me loud. Okay, get even louder. Right there. Go ahead and be clear as you can there. Is this example of the problem? Try and clear that out. Use a chest voice and belt it.
Or up and down. Vocal cords, sometimes called vocal folds, located inside of three primary layers: muscle, ligament, and mucosa. It's the slick outer layer of the vocal cord. The vocal cords open when we breathe and come together when we make noise with our voices, and are covered up when we swallow. A type of lid called the epiglottis closes over the vocal cords when we swallow. Sometimes fluid gets through and we cough to clear it out. When air passes through our vocal cords as we speak or sing, they create a series of sound waves, which we can hear. This series of sound waves we call vibration. The vocal cords create the initial vibrations, which is the initial tones we hear that begin the sound we make when speaking and singing. Now watch and listen as these vocal cords create the vibrations that become our voices.
The mode of vocal cord vibration in normal and pathological conditions has been investigated in several studies. We believe that the vocal cord should be regarded as a layer-structured vibrator in order to explain the features of the vibratory mode in various conditions. This conception is very important for diagnostic aspects and also for simulation studies of vocal cord vibration. This is a frontal section of the vocal cord. As it is the portion at and around the free edge which is moved most markedly during phonation, we will concentrate our attention on this area. The surface of the free edge is covered with thin stratified squamous epithelium, about 50 micrometers in thickness, which extends an average of 1.8 millimeters lateral to the edge and an average of 2.3 millimeters inferior to the edge. From a mechanical point of view, this may be regarded as a capsule whose purpose is to maintain the vocal cord's shape. Underneath the epithelium, there is the lamina propria of the mucosa, which can be divided into 3 layers according to the distribution of the fibrous components, that is, the elastic and collagenous fibers. The superficial layer is rather poor in the fibrous components and appears loose and pliant. This layer is known as Reinke's space. From a mechanical point of view, this layer may be regarded as somewhat like a mass of soft gelatin. The intermediate layer is primarily composed of elastic fibers, whereas the deep layer is dense with mostly collagenous fibers. The entire structure consisting of these 2 layers is known as the vocal ligament. From a mechanical point of view, the elastic fibers are like rubber bands, and the collagenous fibers are more like cotton thread. Underneath the mucosa lies the vocalis muscle, the main body of the vocal cord. The vocalis muscle is like a bundle of rather stiff rubber bands. Thus, quite clearly, the vocal cord consists of multiple layers of tissue, all having different mechanical properties. This shows the layered structure schematically. From a mechanical point of view, we can differentiate the layers into 3 sections. The cover, consisting of the epithelium and the superficial layer of the lamina propria, the transition, consisting of the intermediate and deep layers of the lamina propria, and the body, consisting of the vocalis muscle. The average thickness of the cover is 0.3 millimeters, and that of the transition is 0.8 millimeters. This shows the load-strain curves of each section. The strain for the cover is much greater than that for the body. The strain for the transition is in between those for the cover and the body, but is closer to that of the cover. On the basis of the measurements described so far, and those on laryngograms, we determined the average vocal cord position during phonation as shown in this figure. The 3 layers are simplified into 2, the cover and the body. The thickness of the cover in this simplified model is assumed to be 0.8 millimeters. The ratio of the stiffness of the cover to that of the body can be assumed to be 1:3. Now let us observe the vocal cord vibrations in various conditions. The subject of the first film is a bass singer in a non-professional choir. Almost symmetrical vibrations are repeatedly regularly. You can clearly see wavy movements on the mucosa traveling from below to above. The glottis is closed completely. This shows the results of frame-by-frame analysis over one period of the vibrations. Lateral excursion of 3 points, that is the upper lip, the lower lip, and the tip of the wave, is drawn as a function of time. On the basis of this figure and the nature of the layer-structured vibrator mentioned earlier, we made schemata of the frontal section of the vocal cord model at the times shown with the numbered thin vertical blue lines. This shows the behavior of the layered structure schematically. Let's look at the actual vibrations again. Next is falsetto of a tenor singer. In falsetto, the vocalis muscle is almost relaxed. The entire structure of the vocal cord is stretched by the cricothyroid muscle, resulting in an increase in stiffness of the cover. The amplitude of lateral excursion is smaller than that in heavy voice, and little wave is seen on the mucosa. The glottis is not completely closed. The behavior of the layered structure is shown schematically. Let's look at the actual vibrations again. In recurrent laryngeal nerve paralysis, mass and stiffness of the body are decreased, and therefore the difference in stiffness between the cover and the body is decreased. The left paretic vocal cord is seen on the left side, unlike a normal face-to-face examination. It moves like a flag flapping in the wind, presenting a missing motion. Very small waves are seen on the paretic cord. The glottis remains open throughout. This shows the behavior of the layered structure schematically. Let's look at the actual vibrations again.
ジャックと豆の木、昔あるところにジャックという男の子がいました。ジャックのうちはお父さんが
In sulcus vocalis, the mass of the cover is decreased, whereas stiffness of the cover is increased at the sulcus, or the furrow. The sulcus on the right vocal cord is not visualized because the angle of the light during the filming was slightly inclined. The amplitude of lateral excursion of the vocal cords is small. No wave is seen at and below the sulcus. The glottis is not completely closed. In the schemata, the right vocal cord is drawn symmetrical to the left. The actual vibrations are shown again.
ジャックと豆の木、昔あるところにジャックという男の子がいました。ジャックのうちはお父さんがなく貧乏でしたので。
In polyp, the mass of the cover is increased. Stiffness seems decreased in this particular case because the polyp is edematous. Although there is a small polyp on the upper surface of the left vocal cord, it does not affect the vibration significantly. The polyp on the right moves slightly later than the vocal cord proper, showing a coupled vibration. The glottis anterior to the polyp is not completely closed. The small polyp on the left side is neglected in the schemata. Let's look at the actual vibrations again.
ジャックと豆の木、昔あるところにジャックという男の子がいました。ジャックのうちはお父さんがなく貧乏でした。
In polypoid vocal cord, or Reinke's edema, the mass of the cover is increased and the stiffness of the cover is decreased. The movements of both the vocal cords are asymmetrical. The bilateral polypoid swellings touch each other for a rather long time, affecting the movements of the opposite side significantly. Mucosal waves are clearly seen, especially on the right side. Deformation of the polypoid swellings, as well as the behavior of each layer, is shown schematically. The actual vibrations are shown again.
ジャックと豆の木。昔あるところにジャックという男の子がいました。ジャックのうちはお父さんが亡く。
In amyloid tumor, mass and stiffness of the cover are increased. The tumor always remains touching the contralateral vocal cord, interfering with its movement. The glottis, anterior and posterior to the tumor, is not completely closed. The behavior of the layered structure is shown schematically. Let's look at the actual vibrations again.
ジャックと豆の木。昔あるところにジャックという男の子がいました。ジャックのうちはお父さんが亡く貧乏。
In epithelial hyperplasia, mass and stiffness of the cover are increased. The vocal cords present small asymmetrical movements. No wave is seen on the hyperplastic epithelium. The movements of the lesions are like that of a boat rolling on the waves. The glottis is not completely closed. Now let us look at the schematical representations. Let's look at the actual vibrations again.
ジャックと豆の木。昔あるところにジャックという男の子がいました。ジャックのうちはお父さんが亡く貧乏でしたので。
In carcinoma, mass and stiffness of both the cover and the body are increased. The right vocal cord, which has a carcinomatous lesion, shows little movement. No wave is seen on the lesion, either. The movement of the unaffected cord is small and irregular. The glottis is not completely closed. The behavior is shown schematically. The actual vibrations are shown again.
ジャックと豆の木。昔あるところにジャックという男の子がいました。ジャックのうちはお父さんが亡く貧乏でした。
Breathe in, sniff, and say E, like this. E.
E.
You can see them open and close.
Okay.
Now just hold out an E.
E.
Good. Great. And swallow. Now, let's look at the lateral pharyngeal walls. So a real high pitch E.
Like that?
So you see how the lateral walls on each side come and squeeze in?
Oh, yeah.
Okay.
Okay, now did you want me to go?
There you go, good. Great, turn your head just a little bit to the right.
Oh.
There you go, just kind of look to your right. And just gentle, quiet breathing.
Okay.
There you go. And just real quiet breathing. Great, nice big breath in. Good. Yeah.
Ready?
Start the recorder.
Okay.
Go ahead.
Okay, so I'm going to do, this is on G4, and I'm going to do classic eval, mixed eval, and then belt. Okay. Was that good?
Mm-hmm.
Did you see it? Okay.
Yeah, now swallow for me.
Exactly.
Okay. So this is pulled back just a little bit.
Okay. Now I'm going to do C5, so it's higher.
Okay.
Okay. So you can tell that the top, that's my thyroid, my TA, right? At the
Right.
Okay.
So go ahead. So forward front vowels.
Yes, like ah. Okay, I'll do ah. 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 Okay, so you can't really see it when I'm doing the belt, full belt. So is that the epiglottis is coming up?
It's coming back, and look right here. This is your base of tongue.
Uh-huh.
You see it kind of right there? You get into your taste buds.
Yeah.
So that's pulling back as you do that more. It's pushing a little bit more, and it's making it difficult for you to see. If you do it again, do it without the belt.
Ah.
And then do the belt.
Ah.
See a lot more of the tongue pulling back.
Ah. Ah. Yeah, you can't. I can't really belt without it. I wonder. Ah. Ah. You can see him a little bit there. Okay.
And
now,
you know, vowel makes a difference too, because that
yeah.
movement of the
I'll
tongue
try
affects the
A.
vowel.
Actually, I'm gonna do ah. Okay. Oh, I didn't do this one. Sorry.
It's okay.
Ah, ah, ah. Oh, you can kind of see it that time.
And if you want, I can move so that you can keep seeing it. But if you want to see the effect, I mean, it may be interesting to see how the tongue is affecting or changing as you go. With the stroboscopy, we'll get down and I'll
see more of that. Okay, okay, good. Well, we'll just do the outer ones then this time. Okay, now I'm doing ah. Ah, ah, ah. Ah, ah. Okay, and then C5. Ah, ah, ah. Okay, it didn't sound great, but ah. It's hard to do when I'm in this, like, look, can I move back a little bit? Okay, let me try. Ah, that's easier. Ah, ah. Okay, now I'm gonna do A. A. And this is mixed. A. And then this is belt. A. And then A. 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 Okay. You can't see a huge difference. I mean, at
Not
this
always,
point.
especially not with certain vowels you can't.
Yeah.
Others more than.
Which vowels should I want?
Go through them real fast. Run through all your vowels.
Okay. And both, or I'll do both.
Do both.
Ah, 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 This is weird. It's so weird to watch it happen. Okay. E, E, E. It kind of came more, I don't know, like down, I guess? It's weird.
Yeah.
Okay. Oh yeah, they're much more like this than fluttery.
You see the false vocal cords on each side of your true vocal cords?
Uh-huh.
They really participate more during the belt.
Yeah.
So, okay.
Interesting.
Okay,
Okay.
good.
I forgot. Let me think of. It doesn't. Okay. Let me move it back a little bit. Sorry. Okay. This isn't classical.
Okay.
Hey, Mr. Einstein, here I am. Okay, and then this is mixed. Hey, Mr. Einstein, here I am. This is from Right on My Parade, by the way. Okay. You're like, what is she saying?
I know.
Okay. Hey, Mr. Okay, this is hard. Hold on. I'm going to have to. Hey, Mr. Einstein, here I am. Okay. It's really hard to do in this position for someone. It's easier when I don't look at it.
Okay,
if I'm
yeah.
looking at it, I'm
You
going
can do the last one.
to. Okay. Hey, Mr. Einstein. Okay, that's too high. Hey, Mr. Einstein, here I am. Can you see it?
Yeah,
Okay, I wasn't watching. I don't know what happened.
Just hold out an E.
E. Oh yeah, you can feel them vibrate. Ooh, it tickles.
Does it? Hold out an E.
It's not bad. It's just I can feel it more this time.
Okay, hold out an E again.
Do what?
Just do a straight sound. You can watch the vibration a little bit better.
Yeah. That's really neat.
Yeah, so that's where you can count the open, close.
Oh yeah, okay.
Which,
Okay, can I move back a little bit? Okay, thank you. Oh yeah, you could definitely see it a lot better. Okay. Okay. Now I'll do ah. 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 Oh yeah, they definitely hit a lot. Hit each other harder. I mean, it looks like they're really coming against each other.
yeah, closure is much more complete with the belt, definitely. The breath.
Okay, and I'll do it higher. I'm sure your people outside are like, what are they doing?
No, they're used to it.
Oh, okay.
You'll want to look at like amplitude of vibration as you're going through and doing that. Because when you're doing the belt, your amplitude is less, right? It's not able to travel quite as great because there's that pressure. But the other styles, the amplitude's a little bit greater, which is just the distance from that middle part. So that'll be an interesting thing to look at as well. I
think. Definitely. Okay. Now I'm doing, let's do A. Hey, hey, hey. I did all sorts of different things there. Okay.
Tracking?
Yeah.
Picking it up and
oh, this one. Okay. Oh, okay. Okay. Oh, ah. Okay. A lot of people do warm-ups on ah, like it's easier. I don't know. Doesn't seem to be a huge difference on those, but okay. Oh.
Really have to get down there to see him with that.
Yeah. Okay. I'll do it higher. It doesn't sound great at all. It's here. Let me lean back a little bit. I think it's because I'm sitting. Usually it takes a lot of. Ooh. Okay. Okay.
Let me just get my foot on the.
It may not change the sound at all.
Well,
it may be because I don't know. My throat feels a little scratchy.
Yeah.
Maybe it's because of all the stuff. Okay, I'm gonna have to stand up a little. Okay.
Sorry,
okay. No, that's okay.
Okay. Ooh, it hurts for some reason all of a sudden. Maybe I was using my nose, tensing it up or something. It may be wearing off. It may.
Okay. Are you ready for my voice? Okay. Hey, Mr. Einstein, here I am. Okay. And this is mixed. Hey, Mr. Einstein, here I am. Okay. And this is pure belt. Hey, Mr. Einstein, here I am. Do you think it, oh, I was moving this, wasn't I? Is that why it seemed, this thing, I felt like I was doing this.
I think it was just.
It was just a lot of vibration.
Well, I think it's hard. It's harder for it to connect when you are pressing, when you're using some extra pressing there. So I think that's what it is.
Oh,
Try
okay.
it again though, if you feel like you were moving up.
Hey, Mr. Let me do a little lower. Hey, Mr. Einstein, here I am. Oh, that was easier.
That was better.
Okay, cool.
Okay.
I guess I don't really have anything else.
All right, just breathe in just for a second. We'll get a nice good close-up afterwards. Just quiet breathing. Looks healthy and good. Okay.